Hi, my name is Shirley. I am 37 years old. And at 34 years old, I was diagnosed with stage 4 lung cancer with the ALK mutation. Um, I live in Southern California. I'm a translator. I have 2 cats. I'm married to my best friend. And I like to learn new languages. Currently, I'm learning Japanese and Korean. I started having a cough that wouldn't go away, and I contacted my primary care doctor, and because we were still in the COVID pandemic, my doctor told me, "Oh, it might be COVID or long COVID," but I told him I've never been diagnosed with COVID, so it's not that. And so we did an X-ray, and then I was given antibiotics because the doctor thought that I had pneumonia. And then that cough got worse, and I started developing back pain, and the back pain was unbearable. So I called the doctor again, and I was given another round of antibiotics. We did another X-ray. The doctor said that the X-ray looked exactly the same, so the antibiotics were not doing anything. And after that, we we decided that it was time for a CT scan. When I got a CT scan, the doctor saw a mass, but he told me, because at the time I was 34, he told me there's less than a 1% chance that it could be cancer. Because obviously, when you have symptoms, the first thing you do is you Google your symptoms. And one of the first results that I got when I Googled my symptoms was lung cancer. So at the time, I was already thinking I have lung cancer. And I got a referral to see a pulmonologist. The pulmonologist told me that I was going to get a bronchoscopy. And he also reassured me that it was not lung cancer. He told me that because I had grew up in Mexico, maybe I had tuberculosis in the past, and this was just scar tissue that somehow was acting up right now. But I found it very odd because I never had symptoms of tuberculosis back in Mexico when I was a kid. So we did the bronchoscopy. The bronchoscopy didn't yield any results whatsoever. And then the doctor told me that we needed a second bronchoscopy. We did a second bronchoscopy, same story, no results. I was still undiagnosed. By that time, it was already the second week of, no, the first week of March. And then the doctor told me that it was time to get a wedge resection. They needed to take a little part of my lung to send it to pathology and finally find out what was going on. So I got the wedge resection, and while I was waiting for the results, I ended up with pneumothorax. So I had to stay in the hospital for about 8 days, I believe. And I was discharged still with no results, but still reassured by both the surgeon and the pulmonologist and all the fellows that what they saw when they did the wedge resection didn't look like cancer, that it was not cancer. I went home all happy. Okay, it's not cancer, it's an infection. I'm going to get pills, I'm going to be okay. And then one day I worked from home, and the doctor just told me, "Oh, by Ms. Munoz, we have your results. And it looks like you have adenocarcinoma." And I was like, "Adenocarcinoma? That sounds like cancer, right?" "Yes, it's cancer." And the thing is, we don't think that it's coming from your lung. We think that it's coming from somewhere else. We think that it spread to your lung, and that big mass came from somewhere else. I felt like he was pulling a prank at that time, and I was completely numb. I think the call maybe lasted for like 5 minutes, and I when I remember it, I don't know, I felt so angry that he just called me like that and told me so bluntly over the phone. that I had cancer and that it looked like it could be from somewhere else. So he told me that he was suspecting that it was coming from my breast or from my ovaries, from my pancreas. He gave me so many options, and I was like, oh my god! So my whole body is covered in cancer, like to the point that I have such a big mass on my right lung. So he told me that he was gonna give me a referral to an oncologist, um, and then a referral for a PET scan, because he was making all these assumptions without having a PET scan, without knowing exactly what was going on in other parts of my body. So I had a PET scan. They wanted me to wait a month for a PET scan, but I kept calling all the different facilities in Southern California until I could get an appointment a week later. I had the PET scan, and then 3 days after the PET scan, I went to see an oncologist. And the oncologist told me that they didn't see cancer anywhere else in my body, just in my right lung and the mediastinum area and the pleura, but that she still thought that the cancer was coming from somewhere else. So I got MRIs of my entire body. Um, Still no cancer anywhere else, just in the chest area. And then the doctor told me that basically I was diagnosed as cancer of unknown primary. And she told me that because we didn't know where the primary was, we couldn't treat it as well as other cancers, and that I didn't have any, but that I didn't have many options. I asked her, what's my timeline? What's gonna happen? And she told me, well, if we don't figure out exactly what type of cancer you have, I can give you 3 to 6 months. So it was it was devastating. It was like, okay, I go from less than 1% chance of having cancer to you have 3 to 6 months to live. Um, so the oncologist wanted to give me a chemo that works for different cancers. It works for lung cancer, for ovarian, and for breast cancer. And at the time, I was fed up with that facility. So I spoke to my then boyfriend, and I told him I don't want to get treated there. And then he told me, well, we've been together for a while. Um and maybe you can buy a different insurance. So let's get married. We decided to get married. We had been wanting to get married, but we were not engaged at the time. Um well, before my diagnosis. So we got engaged um 3 days after my diagnosis, and we got married a week after my diagnosis. And we only had 8 guests at our wedding. We got married at a place called Same Day Wedding, and it was the best wedding ever. I loved it. I wouldn't change it for anything. I went to City of Hope for a second opinion, and the oncologist there told me that, judging from the pathology reports that they received from the previous facility, she still couldn't give me a chemotherapy or a treatment that would work only for lung cancer. She told me, you're gonna lose your hair, and it has a bunch of side effects. So you might not have all of them, but you will have some side effects. The oncologist told me that we couldn't wait to get another round of molecular testing before treatment, because the mass was huge. At the time, it was 8 centimeters, I believe, and it was pushing on the vena cava and also pushing on my esophagus. So I was having swallowing problems at the time. And so we started a chemotherapy treatment. I was told that I was gonna lose my hair, which I did after the first cycle. And also after the first cycle, I had an infection, and I had to be hospitalized for about a week and a half. And when I was at the hospital, I was having trouble breathing. I was told that I was gonna go home on oxygen. Eventually, my oxygen levels increased, and I was able to go home. And I started radiation at the same time as the second cycle of chemotherapy. The side effects of radiation to the chest were pretty brutal because I was not able to swallow any solid food, and even liquids were painful. Um, so I had another cycle of chemotherapy. I had three in total, and when I was about to have the fourth cycle, and an immunotherapy was gonna be added to my treatment, the the doctor received a message from pathology that the pathologist had requested more tissue from the initial wedge resection, and to hold off on the immunotherapy. She said, "Well, we found out that you have a mutation, the ALK mutation. So no more chemo, no more immunotherapy. You're gonna take pills from now on." And I was like, "Oh, so I could have kept my hair." And then she's like, "Yeah, well, we didn't know at the time. We just needed to treat right away. So now your hair's gonna grow back, and you're gonna take pills. And I know people that have been taking these pills for years, and they're fine. They're living normal lives. So I think that's gonna be you too." So I was really excited. Um, I I started taking those pills in August of 2021, and yeah, my hair started growing back. I had a little bit more energy than when I was getting chemo. I went back to work, and I was living a pretty normal life for 2 years with no issues until in what month was it? It was in 2023, in June. I started coughing blood, and at first it was small amounts of blood, but it got to the point that I was like constantly coughing blood, and it was so scary. That sent me to the ER, obviously, and I was told that the tumor was progressing. Not the big mass, but another smaller one that was making me bleed. So I had to get a procedure to get that part cauterized to stop the bleeding. And then the bleeding came back a month later. And once again, I had to get the same procedure, but then I was told, well, we need to do something about that progression because that tumor wasn't there. So the drug is not working, at least not in that part of the lung, because it is keeping the other big mass stable, but we need to do something about that smaller tumor that's making you bleed. I decided to get a pulse field ablation, and that ablation didn't have any side effects. At first, I thought that it was going to be like radiation that was going to make me cough a lot and have like issues in my esophagus, but no issues with that one. It was a really nice procedure, just one day, a few hours as an outpatient procedure, and it was nice. So after that, I was told, okay, you can go on with your life. You can keep taking the same pills, the same targeted therapy, and everything was fine until this year in March when I started coughing a lot again. This time, very small amounts of blood, but I was coughing constantly. And then I went to visit my mother in Mexico in May, and I was not able to breathe when I was there. I was gasping for air. Like I couldn't go uphill even even for like 10 seconds because I was struggling to breathe. Um, so I had scans and I was told, well, this time the big mass is the one that's progressing. So your targeted therapy is not working anymore. So after 3 years, almost 3 years on that targeted therapy, I had to say goodbye to it and look for other options. I was seeing two oncologists. Um, One oncologist recommendation was to do a biopsy, and the other one just wanted to switch me to another targeted therapy that was approved for the ALK mutation. I decided to have the biopsy. Unfortunately, the biopsy didn't yield any results, like all my biopsies in the past. And I I was very hesitant to start the other targeted therapy because he has neurological side effects, and I have a history of depression and anxiety. So I decided to explore other options, and then I found out that there was a clinical trial on phase 2 for my mutation. So I decided to start the process for that clinical trial, and I was accepted. And I joined that clinical trial on July 29th. With this new medication, I only have to take one pill a day, which is very convenient. With my previous targeted therapy, I had to take 8 pills a day. Um, and I virtually have no side effects with this targeted therapy. The ones I've noticed is that I sweat more, and I have sometimes I have pimples on my forehead, but I mean that's nothing compared to the side effects of chemotherapy or other targeted therapies. And sometimes I have a little bit of blurred vision, but it's very manageable. I think this clinical trial is very promising for patients with lung cancer with a ALK mutation, and I have had 2 sets of scans since I started because I just started cycle 5, and even though the mass is still huge, it's still like in the 7 centimeter range. Um, it hasn't grown. I'm stable, so I take that as a win. Sometimes we want to see reduction in tumor size, but stable is good. It was a very hard decision, uh, because the first thing that comes to mind is I'm gonna be I'm gonna be a lab rat. They're gonna experiment on me. I'm gonna be taking experimental drug, but I know that it takes many years for research to get to this point. So they're just not going to give you something that's going to kill you or that's going to be so toxic that you won't be able to tolerate it. So, um, besides, it was already phase 2 clinical trial. So I know that some patients had already gone through phase 1 and they were still doing great. So that helped to that helped me decide to join the clinical trial. And also the fact that when you're in a clinical trial, you you get visits very often, you get scans more often, so you know what's going on sooner, and that gives me a peace of mind. I feel like I have a bomb inside of me, and that one day it's just gonna explode, and that's it, I'm gonna die. And even though I've been told that surgery is not an option, I keep requesting second opinions with thoracic surgeons in hopes of getting my entire lung removed. It might happen one day. I don't know, but I've been told by many surgeons that it's not an option. But every time I wake up, I'm aware that I have this inside of me and that it's been there for years. I don't know for how long. And that one day it's just going to grow and it's going to be even bigger than it is right now. And I don't know what's going to cause. Maybe it's going to make me bleed to death. I don't know. Um, it feels like I have like an enemy inside of me. And sometimes I make fun of it. I give it names, like villain names. But I wish it wasn't there, obviously. If my story could help someone going through something similar, I would feel like my life has a purpose, because sometimes I felt like I came to this world and I didn't have any purpose, I didn't make any positive contributions to the world. But I feel like if now with what I'm going through, I can help someone get diagnosed at an earlier stage or get a better treatment option, I feel like my life had a purpose, or has a purpose. Lung cancer can happen to anyone with lungs. You don't have to be a smoker. You don't have to be old. It can happen to the healthiest person. And even if people are smokers, they don't deserve to have lung cancer. Sometimes it feels like when you say that you have lung cancer, people judge you and blame you for it. But I see it like even if you're a smoker and you caused it, which is not the case, you still don't deserve lung cancer. It's a horrible disease, and even though the treatments have improved so much in the last 10 years and the overall survival is way higher than it was before, it's still the deadliest cancer in the US, and it needs more funding. So I always encourage everyone to donate to lung cancer research to keep people like me alive for longer and to finally find a cure, because too many people in their 20s, 30s, 40s are being diagnosed with no risk factors. Because at least if you have a risk factor, now there's screening for lung cancer. But if you don't have any of those risk factors, you're most likely gonna end up being diagnosed until you develop symptoms that are so evident that you're gonna end up being diagnosed with stage 4 cancer, which is incurable. And I hope we can change that.